About to go live. Hi there. This panel is about COVID-19, but in particular, we're going to explore with the panel lessons from the HIV/AIDS epidemic, which of course dawned in the United States in the very, very early 80s, late 70s. So we have a terrific panel today to explore lessons from HIV and AIDS for today's pandemic, COVID-19. A couple of us will be on this panel, lived through those early days of the HIV/AIDS epidemic. We discovered some lessons very much the hard way about the importance of prevention in particular. We were so frantically searching for treatment and cure, which of course became very important, but much later. And it became so apparent that the priority had to be preventing new HIV cases, because ultimately, no matter what scientific interventions or treatments came about, there wouldn't be enough money in the world, or even in the United States, to treat all the people who were coming down with HIV if we didn't really get a handle on preventing it. That to me seems like a global lesson for COVID-19, but we're going to get underneath that. I know the panelists will have additional thoughts on that. It's a terrific panel. I'm really excited to be the moderator. We have Nina Kossoff. Nina, I think, will really enlighten the conversation from a lot of points of view, but I'm really excited, Nina, to hear your perspective on the lessons from HIV and AIDS on COVID with regards to messaging, communications, branding. I know you have some expertise in that. It sounds maybe at first like a trivial issue compared to a pandemic, but in fact, I think a big lesson of the HIV/AIDS epidemic was that communications became as important as science in many ways, raising awareness, reaching people who needed to be reached, taking on stigma, and again, back to prevention. So I'm really excited to hear from Nina. We'll also be joined by David France, who has been through it for decades, a very accomplished journalist in many other respects. I'm honored to be on the panel with you too. David, excited to hear your lessons for us today from all of that experience in the queer community and with the HIV/AIDS epidemic. We're also joined today by Eric Cervini. Eric, excited to hear from you too. Another person with a real historic perspective on history, a historian yourself. I know your particular focus has been on the 1960s. Again, a couple of us on this panel actually lived through them, but we haven't studied them nearly as thoroughly as you have. So some lessons, I think, today about from that decade, which was also a very divisive decade and a scary decade in so many ways, but different, as you know better than I. We were divided by generation, perhaps more than by ideology. And then, of course, in the 70s and 80s, the queer community felt alone. The HIV/AIDS community felt alone. Since then, alliances have emerged, coalitions, community. It's a very different world today, but I'm sure, as always, if history doesn't repeat, history rhymes. So it'll be we'll be very excited to hear your perspective too. David, I'm going to start with you, if you don't mind, just because, again, you have a long time of experience on this. I wanted to get you to talk about one thing in particular and then take it wherever you like. But I was just thinking about how stigma was such a problem. You know, that initial response to HIV and AIDS, there was so much fear and negativity and toxic politics that people affected by HIV/AIDS were stigmatized, and that did not help at all. It drove people underground. It replaced science with fear. And so I'm wondering, just to be a little provocative, if we as progressives need to be sensitive to how we might be repeating some of those mistakes by stigmatizing the anti-maskers or others, as opposed to reaching them in a more compelling way, as we found out we had to do with HIV and AIDS to get everybody to recognize the public health threat. So I'm going to stop talking and start with you, David, but take us through a little bit of perspective on this from your many years of experience.
Well, thank you, Daniel, and thanks for having me here. It's great to be on this panel with Nina and with Eric. The stigma, and unless you lived through it, you really would have no reason to know how totally stigmatized the queer community was back then. There was no, I mean, we had no role models, we had no advocates, we had no elected officials, we had no openly gay anybody really who had any sort of a platform to speak in favor of the community and to advocate in a public way, which is shocking. It's shocking to remember how far away we were from any sort of political clout or agency back in 1981 when HIV first came. And then, of course, you add to that the stigma of a fatal and mysterious disease. And it was a toxic stew that made it impossible for us to try to find anybody to do scientific research. Scientists, especially virologists, are well known for their kind of cowboy nature. They love a new disease, they love a new challenge. And here was one that they just didn't care to go anywhere near. And it wasn't until 6 years into the pandemic that any medication was made available. Like literally for 6 years, there was nothing a person could take. And even in 1987, when AZT came along, it didn't do much. It certainly didn't save lives. It may have prolonged lives in some people who could tolerate it. So the stigma that had to be overcome was really broad and necessary. And that the activism that brought us to fight that stigma is the same activism that brought people who are with HIV and AIDS themselves into political discourse and scientific discourse with the research community that helped bring about the kind of breakthroughs that were necessary to make HIV a survivable disease. I think the stigma that you're talking about now against people who are not taking public health into their hearts and into their considerations, I think it's alike in some ways and different in other ways. What was being stigmatized in a parallel way back in the plague years of AIDS was sex itself, that people were being blamed for contracting HIV long after they knew what caused it. And for many years, we didn't know what caused it. And the way to interface with them was to engage them in risk reduction, to try and have them embrace this sense of love for themselves and love for the people that they were engaging with, and love for the community in general, and love for life in general. And it really needed a very positive message, this prevention message. And it wasn't enough to say it once, and it wasn't enough to say it in one way. It had to be said over and over, reformulated for new generations, for new populations of people. And it's something that people are still working on today, trying to make sure that prevention which is still our main tool against HIV. There is no cure for HIV. Prevention messages are constantly being created and resold. There was a joke in ACT UP that ACT UP was selling AIDS and AIDS activism the way Madison Avenue was selling like Madonna's new record or the new Coke. And in fact, it was because the people in ACT UP in AIDS activism were the people who were selling Madonna's records, and the people who were selling, they harnessed the powers and tools of marketing and of influencing in such a way to make it seem really cool to protect yourself from HIV, and really cool to fight for treatment and political space for people with HIV/AIDS and those who love them. And I know that we haven't done any of that Madison Avenue kind of work around prevention for COVID. And I've been shocked that we haven't seen it, really. That certainly the messages out of Washington are, upside down and really confused, just inexplicably bizarre. And but we haven't seen ways, I think, to cope with what we see every day, even here in New York City, people who are refusing to wear their masks out of some sense of agency or belief in their own freedom to make those decisions. Because unlike HIV, the people who are at risk for COVID are not necessarily the people who are not wearing the masks, but the people they know and the people that they love and the people that they will be in contact with later. And so I think the role of marketing in activism and progressive activism especially is really key and needs to be addressed.
Yeah, thanks for raising that. And again, Nina, I'm interested to hear your views on that in a moment. David, you raised so many interesting and important points in those few minutes. I want to seize on just one. In those long 6 years, I remember too, where we didn't have anything effective to combat the disease. We also didn't have a national narrative, any federal leadership explaining to us what we were going through, what we knew, what we didn't know, what we could do and what we couldn't do. As knowledge became available, we lost a lot of time, as you know, lost many lives unnecessarily,
Right.
partly because out of fear and a lack of a national narrative, I think, of leadership, the message sometimes felt like you just can't have sex. You just have to stop. And in fact, it was important to know what you could do as well as what you couldn't, to be realistic, for
Right.
people to go on living their
Right.
lives. And I see some parallels with that today too. There's a temptation to just say, oh my God, this thing's so scary, I'll just never have human contact again. But people need to know, how do they go about family life? How do they go about work life? How do they go? And again, it's just literally killing us that we don't have a leader at the federal level who's giving us some kind of narrative, isn't it?
That's absolutely true. And, you know, so many of the people who are responding to COVID today are people who responded poorly initially to HIV/AIDS, the same people. And I'm talking about people like Tony Fauci and Robert Redfield and Deborah Birx, and the people on the national stage today were people who started out not as fierce advocates. In fact, just the opposite. And they were schooled. You know, they were taken to school by AIDS activists. There were no politicians back then, of course, who were in the camp of gay people, or very few. But what we have today is at least this bench of science that knows how to respond to a pandemic, knows how to make science work in an ethical way and in a moral way, in a nimble way, and they've been sidelined by this administration. You know, the big question we should all have and should have had for the last 7 months is, where is the CDC? It's the Centers for Disease Control and Prevention. Those are the people whose job it is to give us those messages. We know the people inside that organization because we taught them. We made them know how to respond to something like this, and they have been kneecapped. We haven't seen them. We haven't heard from them. So it's not just the politicians, Daniel. It's the whole institution of our American public health machinery that has been just subverted and taken away from us. And we could have had this leadership right from the day one. We have the people in place to give it to us, and they've been muzzled.
Yeah, just listening to you, I think probably people tuning in, I know myself, it starts to make some tragic sense how we're losing so many more lives than virtually every other place in the world. But when you talk about the way you just did, the magnitude of the way we're being let down by institutions that are either failing or being subverted is just chilling. Nina, one of the many ways you've distinguished yourself, as I said, is helping the world to understand this thing about messaging and communications and raising awareness that's so critical in a public health emergency. In HIV and AIDS, we all remember we had silence equals death from ACT UP. We had red ribbons that everyone wore to show solidarity. How do you think, what are the comparisons you see? What's going right? What's going wrong? What are some of those lessons from HIV/AIDS in that realm today?
I think in some ways like wearing a mask is its own symbol of solidarity and trusting and keeping each other safe. I think that what feels quite complicated about all of this, and I think is central, is sort of like the challenge of the marketing of it, is that marketing demands you simplify who your audience is, for example, right? So like if my background in marketing or my work in Them's Health is focused on a really specific audience, there's a lot of room left to be desired in terms of like the vast differences among that. And so I think I just want to call attention to the fact that we have a panel of us. I don't want to speak to anyone's races but my own, but we don't necessarily have representation from the trans community or the Black community, or particularly Black trans women, the sex worker community, people who are still so greatly at risk for HIV and AIDS, and who we still have left behind since the epidemic, right? And I think that we're starting to see that come out more now, I think, if ever. But I think the simplification in that messaging, what's interesting now that's different is that, like, we have all of this conversation around essential workers, right? And we finally have a little bit of an understanding, at least in New York. So I guess I'm not to speak to the country, but there's an understanding in New York that essential workers are specific races, specific income levels, and specific types of people who are at risk, right? So we have poor Black and brown people who are at higher risk for COVID. And that is something that's still true today to HIV and AIDS. And it was true during the epidemic in its first iteration. And I think that, I think that we need to sort of not be beholden to just like the simplest form of marketing or communication. And I think that's like, it's necessary to galvanize around in a certain place. So getting to this like mask level where if you're wearing a mask, it means that you respect others' health. Or I've gotten into deep conversations that wearing a mask, or rather not wearing a mask, is its own racist behavior because it's more likely to put people of color at risk. And so, yeah, I don't know, I guess like, background in marketing, it's so easy to say that like, surely there's an easy way to communicate en masse, but like, it's such a complicated issue across all of the different people who are affected. And there's a lot of positive to be learned, I think, from what happened with the HIV and AIDS crisis, and what and who was left out of that and who is still falling behind for that.
Yeah, of course, that's so important, what you just raised, Nina, that those dark days that David was describing where, literally people with HIV were rejected by their families, their churches, their employers, medical establishments, even mortuaries wouldn't bury them. And then we got to a place where there was, what some people have been called the Great American Response to HIV/AIDS, because we overcame a lot of that, and we absolutely left the most vulnerable communities, some of the most affected communities behind in that frantic struggle from the dark days to the Great American Response. And I want to accept some responsibility for that too. I was involved in the HIV/AIDS movement at that time, and tragically, by neglecting communities of color and women and lower income people, not having those voices at the tables of power as the AIDS movement finally gained some power and some voice, that cost us another tens of thousands of lives, because we didn't hear the critical importance of prevention and reaching communities, through communities with their own voices in the lead. And we lost more time, kind of on our watch, I have to say, making matters even worse. So that's a critical lesson. Anything else to add on that or other subjects, Nina, before we ask Eric to jump in?
Yeah, I think just the last thing is like, there's so much to be learned from the resiliency of the most marginalized communities. So for instance, there's a woman in the Bronx named Ms. June who runs something called the Heavenly Angel Fund Project. And it's specifically focused on Black trans sex workers, brown trans sex workers, and getting them tested for COVID-19. And so working with people who maybe, like, there are worse fears out there in a lot of ways for some people in this existence right now, that are just worse. Like, there are worse options than getting COVID-19. And so encouraging people to take that step when there are so many other things going against these types of communities, that's like a terrifying gap, right? You would rather choose COVID than the risk of being murdered, for instance, that we're still seeing happening across the country. But yeah, I don't know. I think it's just something to think about in terms of like the most marginalized communities are always there for one another. And I think the rise in mutual aid and the direct response of people just sending each other money, at least through the queer section of the internet that I and Them's Health reside in, is really inspiring and really exciting to see people using whatever financial resources they have to support that. But I think sort of back to the point of like the lack of leadership from government or any other elected officials or organizations for including everyone and bringing everyone along, is that we best protect ourselves, right? Like we best support each other and can protect ourselves because we can speak to one another rather than, I think, this like terrifying politicization of it. And I think that that's, of course, something that happened during the HIV/AIDS crisis, but that we're seeing now as well, that's continuing to leave people out.
Yes, indeed. Thank you so much, Nina. Eric, I know we said this panel was about lessons from the HIV era, which is really starts, circa 1980. But because you've also delved deeply into the 60s, I want you to feel free to, take your perspective on the queer movement as far back as you think is helpful to understanding our place in this COVID pandemic today.
Mm-hmm. Well, first of all, I want to say how much of an honor it is to be on this panel with all three of you. David, I've learned so much from your documentation of history, and something, Daniel, that you've lived. I have a life of activism, and Nina, now you're continuing it. So it's truly an honor and privilege. And yeah, I studied the 60s and the gay purges, the purge of sexual deviance, and what I write in the epilogue of my book is that the AIDS crisis brought about not a purge from employment, but a purge from existence that was really perpetuated by and enabled by the federal government. And I think something that you notice, taking a kind of broader look at history, is that it's times of crisis when those in power who feel threatened tend to target the most marginalized, the same groups that Nina was just talking about. And I don't think it's a coincidence that as we're seeing this epic failure of unprecedented proportions happening with this pandemic, I don't think it's a coincidence that you're seeing the Republican Party's war on trans children in Idaho, or that you're seeing the federal government attempting to roll back protections of trans folks who are seeking medical treatment in the middle of a global pandemic. And time again through history, there's always going to be a scapegoat identified whenever there is a failure or someone who feels threatened at the top of the hierarchy. And so I think, yes, we should be celebrating some of the successes that we've experienced, especially at the judicial level. And you're seeing some of those judges just yesterday attempting at least to block those new laws that were popping up in Idaho and also in Washington, D.C. But it means we also have to stay vigilant. And I also don't think it's a coincidence that the murder of Black trans women has doubled this year. We're now at a rate exceeding that of the entirety of last year. And so I think it's exactly these conversations of saying, yes, we're fighting this pandemic, we're fighting for everyone's lives, but who are also being forgotten, and also who are most at risk of being thrown under the bus. And I think that's something that you see, whether it was the Lavender Scare, or whether it was the Inquisition, or whether it was the conquistadors coming over to America. You see it time and time again, and that's what we have to prepare for now.
And I guess if I could just,
please.
Sorry. Just one thing really quickly. I don't know if you all saw the March for Trans Lives back in June, but one of the speakers, Raquel Willis, made a point that while white queer community gets to worry about policy and rulings of government, for example, the Black community is worried about living, right? Like worried about their lives. And so it's so deep rooted in our history as a country to leave out Black and brown people that it's like obviously the policy wins are exciting, and it means progress, and it signals progress, and it does do a lot for communities, but we have to focus on both. Like, how do we bring people along with us and not just say it's a legal battle or the representation by the government or whatever ways that's useful for some, but not all, I think.
Yeah, absolutely. And Eric, I really appreciate having a historian on the panel, because, when I see reports in the news of some of the religious extremists blaming the COVID epidemic on trans people getting rights, in a kind of superstitious way, I know it's easy for a lot of our progressive friends and for intellectuals to dismiss that as laughable and ridiculous, but in fact, it's very dangerous. Anyone who understands history and our species and the HIV/AIDS epidemic understands that that's very closely related to the violence that Nina's been talking about against the trans community, particularly trans women of color. And it's a huge barrier to getting a handle on an epidemic like this. It just can throw things completely off track, even though they seem like lunatics and arguably are. It's dangerous lunacy. So thank you for raising that too. Mm-hmm. So David, as you listen to Nina and Eric, anything else come to mind for you? Again, the perspective of having been through one epidemic and now, sadly, we're through another.
Well, you know, one of the things those of our generation, Daniel, asked ourselves when this pandemic hit was whether or not we were, you know, in a specially prepared position for it. And I guess what we've realized is that surviving one pandemic does not give you all the lessons and tools that you need to approach the next. Certainly, so many of the issues are the same as both Nina and Eric and you have pointed out, and so many of the people who are suffering. I know Nina has said before that the HIV/AIDS pandemic in the U.S. today is largely a trans and Black and brown pandemic. It's still raging there in an uncontrolled way. The messages that we were talking about before, those prevention messages, haven't reached that audience, and they need to. Medicine, the whole medical establishment has left out so many Americans, and we thought, at least we liked to think, that we fixed a lot in AIDS, and what we realized is how much really went untouched in all those years, and was the broken part of America that allowed this pandemic to just take its course.
I want to get your guys' reaction to something specific from the HIV/AIDS experience. The arrival of AZT. It was on the one hand, this relief that finally there was something that felt like hope. It turned out to be a mixed blessing, that's for sure. And I'm just wondering, Eric, again, with your historic perspective on things, do you see some lessons from AZT for as we anticipate the early vaccines, the arrival of the first vaccines? Anything we should remember from the AZT experience that should inform how we as a community, communities respond when those first vaccines arrive on the scene?
Well, I'm sure David probably is a better expert on that exact phenomenon, but even thinking of the history of ACT UP, what was the first action? Well, it was protesting Wall Street. Why? Because of Burroughs Wellcome pricing it as the most expensive drug on the face of the planet. And I think you're already seeing a very similar phenomenon when it comes not just to the vaccine, because we're not even there yet, but with testing, right? You hear the stories of parties in the Hamptons having these 30-minute rapid tests to gain entry. Yet, if you're living in an underserved area, then it could be next to impossible to find proper testing, or at least it was until very recently, and there's still issues. And so I think that concept of the disparity and lack of access that track perfectly along class and racial lines across the country is something that, again, we have to be vigilant about, and we have to hold those, empower those who are allocating whether it's tests or vaccines, hold them accountable. And quite frankly, you're seeing something really similar when it comes to voting, right? When you look at the removal of polling stations, it's those with the least resources, those who are the greatest victims of systematic racism, who are having their votes, their ability to vote taken away. So I think it speaks to a much larger phenomenon in American history that shows how intricately tied race, class, access, and privilege really are.
Yeah, I love some of the memes I've been seeing going around that make the point that if your vote really didn't matter, they wouldn't be trying so hard to stop you from voting.
Exactly.
That's definitely something to pay attention to. David, illuminate us, if you would, about lessons from AZT for these much anticipated COVID vaccines. As I think everyone here knows, AZT, there were people for whom using AZT made them less able to benefit from the drugs that came next, the next generation. So it was just, such a stressful, hard time to navigate. What do you see some of the lessons
Well,
today?
I was just talking about this morning, actually, Daniel. The AZT was released in an emergency use authorization, meaning the phase 3 trial, which is the large scale safety and efficacy trial, was stopped. It was halted early. It was not allowed to go its course. It was determined from an early reading of the data that people were faring better on AZT than they were on placebo. And it was released like that. And we didn't know what that drug was. Nobody really knew what it did, what it could do, how safe was it, how effective was it. And it turned out that it was not effective for half the people who took it, that they couldn't even tolerate it. The toxicity was so high. And it took many, many, many years before a large scale phase 3 trial study was ever done. It was called the Concord study, done in Europe. And that study showed us that AZT did nothing to extend life. What are we looking at now? We're looking at the United States and Russia and China and Europe. Everybody is looking at ways to promise a vaccine before the end of a phase 3 trial. And it is an almost certainty that that Washington will get an emergency use authorization for this stockpile of vaccines that they're putting together. And they will, everybody's worried about the October surprise, roll out this vaccine that we know nothing about, and deliver it as a kind of a political deliverable. That's what everybody's worried about, that we will be given a vaccine that we don't understand. Vaccines have great potential to cause harm. We really need to know what science tells us. And I think it's a really an apt parallel to talk about the AZT experience. AZT in the long run was not a demonic medication. It proved to be an essential part of the 3-drug cocktail that was brought out in 1996. It worked very well with other antiretrovirals, but as a monotherapy, and all the people who took it all alone initially, that it made them less likely to respond to the next drug and less likely to respond to the one after that, and made it so when this breakthrough came in 96, they were in many cases out of reach of the modern medicines. And will we put politics before science in this instance in COVID? And the answer is almost certainly yes. And that's why I brought up Russia. Russia announced that they have patented and are now rolling out the world's first effective vaccine. There's no science, there's no data on any of that. And the parallel between kind of that sense of nationalism that's been rising up all over the place, not just in our own country, is suggestive that that we need to hold the regulatory agencies' feet to the fire. Like if I were ACT UP today, I would be at the FDA, and I would be standing at the FDA every day between now and the release of the data for the phase 3 trials on these vaccines to make sure that we understand what they are and make sure that no trucks pull out of the loading bay with vaccine until that moment.
Very instructive. So Nina, let's stay with politics in a way for a minute. And I want to see if we can find some more hope and silver lining. One of the things that did emerge from the HIV/AIDS epidemic was some empowerment of a community that, as you pointed out before, came together, saved ourselves. The only thing that really ever worked is people doing it for ourselves. As you mentioned, left a lot of people behind and out, tragically. But is there a better version of that today? I think you were born and raised in Ohio, weren't you, Nina? So Ohio's an important place in America and in American politics. Is there something you can envision in places like Ohio and elsewhere in the country that can bring communities together in a positive, hopeful way in the face of this terrible threat?
I mean, I know it's gonna sound catering to my own project, but following along on certain Instagram accounts that are actively including a variety of voices feels like a way to me to learn about what other experiences are. Like, I think that we as or at least myself within the queer, trans, non-binary community, and I think the LGBTQ community at large, in a lot of ways, we are primed whether we take advantage of it or not, to listen to other perspectives, right? Because we are such a small proportion of, I mean, we're not that small, but it's still like a comparatively small population in the United States, right? And so we are more likely to have friends or folks in our networks or acquaintances of different backgrounds, of different socioeconomic statuses, of different areas of expertise, of different just like political opinions. And I know that that leads in a lot of ways to the same sort of liberal centeredness, but everything else that arrived there, I think, is a lot different than what many parts of particularly straight America are sort of insulated from by having friends who are of similar socioeconomic statuses, of similar experiences, of similar backgrounds, because they've not been forced to find other people in a way that we as queer community have to find. We have to create our chosen families, right? And we have to find others wherever they come from. And I think that if we are seeking out or finding ourselves among other viewpoints and other experiences, that we're more likely to be inspired to find new ways of thinking. Because the direct on-the-ground response of Black trans sex workers in the Bronx, for instance, is not something that's my experience as a Filipino Jewish kid from Ohio, but it's massively informative for what we could be doing and how we can thinking about how we protect ourselves. And I don't think that happens at mass scale yet. I think that we're starting to see it as we saw in response to Black Lives Matter with the sort of internet challenge week of Amplify Melanated Voices, that we were getting other perspectives in front of audiences that may not necessarily have heard them before. But that, I don't know, that feels like an optimistic place for me, but it does require work on the part of the individual to seek out voices that they may not be familiar with and just begin by listening and seeing how other people are viewing the problems. And I have to take that myself too, and sort of finding the ways to understand why people don't want to wear a mask, for instance. But I think, to sort of the point that you made at the beginning, like understanding where someone is coming from, whether we like it or not, is a way to understand how to then overcome that, or how to sort of innovate to move past it.
Yeah, profoundly true. Thank you. And your project gives me hope too. So I hope people will find out more about that. And I hope they'll read your book, Eric, and keep following David France. I think there's also some wisdom out there, even beyond this brilliant panel, maybe trying to weigh in. Is there a way we can see if any questions have come in from viewers or listeners, or I might be getting ahead of the producers on this. We do have a question. So this question is from Stephen. He says, what can we do as advocates and activists to help shift focus to BIPOC and trans communities, which are more impacted by AIDS and COVID, yet ignored? Do you want to start on that one, Eric? Want me to read it again?
I got it. And love this platform. I love being able to see it right in front of me. Yeah, I think, what Nina said about elevating platforms that already exist in organizations, in whether they're Instagram accounts or actual membership organizations. I think we have to remember, just as the gay rights movement or the queer liberation did not begin at Stonewall, but it was essential. Just like now, Black Lives Matter did not begin with the murder of George Floyd. It had been existing. People have been doing this hard work for a really long time. So a lot of folks who look like me, including myself, have been wanting to educate ourselves and wanting to contribute more. And I think remembering that, posting the black square is not enough. Posting a few memes is not enough. You have to set up that recurring contribution to organizations like the Sylvia Rivera Law Project, Marsha P. Johnson Institute in San Francisco. You have the Transgender District, which is doing incredible work. And these organizations need recurring support and financially and otherwise. And so even though June is over, the movement is far from being complete.
Amen. Nina, did you have anything to add to that?
Yeah, I mean, I think that the amplification of issues outside of your own personal identity is a way to get that attention for it, right? Or is a way to sort of increase awareness around things that people may not already know. And I mean, in its own ways, it can be quite complicated on the internet, because people, like, as soon as you start talking about new issues and people, if they assume you're a matter expert, for instance, like, it can be hard, or people have a lot of questions or doubts, and perhaps someone's not prepared for it. But that sort of academic argument is nothing compared to the lives on the ground, or the lives lived who may be at risk. And yeah, I mean, the work has been happening. It doesn't take long. I've created a very long list of Black and brown focused LGBTQ plus organizations doing work in these areas, including Sylvia Rivera and the Marsha P. Johnson Institute, House of Gigi, what else is there? Transgender District. On the advisory council of one called Third Wave Fund that has been around and was funding something like Glitz House, which had a really incredible, like, viral moment where they raised over $1 million to buy a home for trans women in New York, just a full building to be able to own property, which is already radical in itself when you think about the communities. But they've all been out here. And Third Wave, for instance, was funding Glitz House long before it came into this big viral conversation. And so, yeah, I think to Eric's point, like, finding what's already out there and sort of reading and digesting and then amplifying that work that's been done. We don't have to reinvent the wheel or anything to support BIPOC or Black, Indigenous, and people of color, because the work's out there.
Yes, and we have to tap into that wisdom of lived experience, don't we? I remember my grandparents, my grandmother and my grandfather used to repeat a quote that went something like, "I may not know as much as that expert about all that, but I know where my shoe hurts my foot." And there's so much wisdom in the words from my grandparents and others. Can we get another question from outside? Here we go, from Michael. Has the HIV experience made some people, especially gay, bi, men who have sex with men, better able to navigate some of the aspects of COVID prevention? How to discuss risk with others you want to come in contact with? Great question, Michael. David, can you start on that one?
Well, I guess it has. There's also something about having made it well into middle age that makes it easier to have those kind of frank conversations anyway, and makes you just not worrying about trying not to offend people. But yes, and so I do think that is true. I think what we learned in HIV/AIDS and was risk reduction. It's not the same as locking yourself away and making sure that you never ever get in contact with the coronavirus. It's measuring ways to orchestrate your own life and go about existing in community in ways that make it considerably safer for you to be able to do it, and to measure things in the way of reduction of risk rather than kind of true kind of pure isolation. And I think those lessons have taught us so much, and they're certainly applicable today. And New York City issued a series of suggested safer sex guidelines for the era of COVID, which is something that you wouldn't have imagined a municipality, much less the great New York City, doing in the back in the 80s. But yeah, they actually delineated ways that you could meet one another on hookup apps and still experience a kind of a life, different, altered, maybe not the most desirable, but there are ways to rethink the things that we like and find our ways through this period, which looks like it's going to last for a while longer. And I think we have HIV and AIDS activists to thank for that.
Yes, I agree with you. Let's take another question. These questions are great. What else do we have here? From Barbara. Thanks for this. I'm interested in points of light and hope. Where are the places and communities who are coming together to work for more health for all? Any you guys out there on the ground, any place in particular that gives you hope that we all need to emulate or take lessons from? Nina, you want to start? I
don't know that I can talk about a place. Certainly there are people on the ground who are demanding taking this opportunity to say it's time that we have to fix the healthcare system, and we have to do it urgently. And we have a kind of a weapon that we can use to make that point so clear in this pandemic with the rollout of effective vaccines, because it won't do anybody any good unless everybody gets the vaccine. And that commitment is an essential one, or everything is lost. And that gives us this kind of powerful scepter that we get to swing around and say, we must create a healthcare delivery system in the United States, and in fact, in the whole rest of the world, that reaches everybody with basic fundamental healthcare and access to doctors and medicines that hadn't existed before. So this is, I think, a great opportunity, and hopefully it's one we'll seize.
Yeah, one thing about a public health crisis is it really does expose the myth that we can somehow live in this bubble of privilege and comfort and safety for long while ignoring the suffering and struggles of others. Nothing brings that home like a public health emergency. Sad that it takes that, and sometimes even then we fail to allow it to be the equalizer that it really is by nature. Eric, any other thoughts on the points of light here? I mean, I'm sad to say the ones I can think of are not within the U.S. borders. Some things seem to be going well, but mostly in other places overseas. Anything you're aware of here at home?
Well, I think in a way it's good news, but in a way it's tragic because you have every virologist on the face of the planet working on this. It does give me hope, right? I think seeing the collaboration between scientists now and a completely unprecedented global effort does give me hope, but it also, I think, makes the AIDS crisis all the more tragic, because it shows what could have been if there had been the proper allocation of resources to fight that virus, and if it truly had affected, or if people realized that it was affecting everyone, then maybe we would have had so many fewer lives lost. And so I think we should certainly learn from the mistakes, but also be vigilant and also honor the activism. And
it's inspiring too, isn't it, Nina, just to see, as we did with HIV/AIDS, the heroic efforts of nurses, frontline workers, and now teachers. I remember even in the darkest times of HIV/AIDS, there were people that just showed enormous capacity for courage and compassion, even not knowing what they were risking. And we're certainly seeing some of that today, aren't we?
Yeah, absolutely.
Great. Okay, let's take another question. Did you have something else, Nina?
Oh, I was going to say one thing that sort of both of the previous questions had me thinking about in terms of like navigating this new type of consent is something that within, I think, especially the queer community, something that brought me a lot of joy recently is there's a queer trans dating app called Lex, and it's sort of based off of the newspaper Personals of times past. So it's no photos, no anything, it's just language, but they posted a guide the other day about like their guide to dating during the pandemic. And it was really, really centering like virtual dates, like do a Zoom, like once, like by your third date, maybe you can figure out how to like meet in person from afar. And like they're sharing stories about people doing that. So like their content stream is also supporting it. But it's this really nice balance that like we can create these new forms of connection. It's going to feel and look and be really different. But it's in a lot of ways so similar to a lot of language around consent with relationships or with sex anyway, about like what feels safe and how do we do that. And kind of beyond that, I've also seen so many young folks writing their own like guides to social distancing or normalizing asking all of these things. So again, like in the language of, or what we know about like sexual consent and what we can build from that, like how do we just normalize asking all of the types of questions? If you want to make plans and asking a friend, like, are you comfortable wearing a mask the entire time we're together? Because if not, I don't want to see you. Like, and like being able to make that really normal. And I like David, how you said it, like now at your age, like once you've arrived at a point, you're like, no, thank you. But it's been amazing seeing young folks doing that too. And like leading the way in terms of like like, we're gonna change how we date, or we're gonna change how we get in touch with one another, we're gonna change how we move about the world together in this moment.
Mm.
Yeah, I love that. That's I think that is a point of light, ways in which, you know, this can force us to work through some of our toxic puritanism. I remember David will remember condoms were just considered obscene. Like, you couldn't talk about condoms, you couldn't, you know, advertise condoms, you couldn't, they were just, you know, off the table. And once it became so clear and presently a matter of life and death, we ultimately, you know, brought them into the public discourse and distribution, not without tremendous resistance. And I'm sure there still is some of that foolishness, but it was a sea change. It was definitely a cultural change before and after HIV/AIDS, just in how we dealt with something as simple and life-saving as a condom. Is there another question we have time to put up real quick? From Amy, thank you. When did Dr. Fauci begin his work to help save the lives of people living with AIDS? David, that question has your name written all over it.
And the answer is simple: day one. He was already practicing. He was already at the NIH when the first cases came through the door. And as an immunologist, an infectious disease specialist, he was seeing the first patients, and also overseeing the NIH's funding for research. So while I said that everybody had a learning curve, his learning curve was pretty steep at first. He was a great clinician and has remained a clinician, you know, as central as he is in the American research establishment. He still sees patients, and that has been an important thing for him. And it took him years to realize that he had to do what the activists were telling him to do. And then once he figured that out, and he didn't do it just because they were telling him to do it. He did it because they were right, and they convinced him. And then he became a real ally.
Yeah, he did take heat, and, you know, there was a journey that needed to happen between activism and the scientific community, as you recall. What do you think about now when you look at Dr. Fauci, a different stage of life, still in the thick of it, still taking heat of a very different form now? Like, what, as someone who's known him, observed him, what do you think when you look at Dr. Fauci and his place in American society and history?
You know, he's 79 years old now. He's nowhere near retiring, at least the way he sees his trajectory. This is the most difficult assignment he's ever drawn. I mean, HIV/AIDS is it was a killer. It killed many people. It was a challenge. It remains a challenge. You know, he wants to retire once they find a cure for HIV, which has eluded everybody. And he's worked, you know, he's also a politician. He's worked for Republican administrations and Democratic administrations. He's been beloved by presidents, one after the other after the other. It is the fact of him being a politician that has frustrated many AIDS activists over the years. They want to see him be more of a pure scientist and advocate for that kind of data. But here he's being challenged as a politician in a way that I don't think any other scientist has ever been challenged. And you can see it wearing on him. He's exhausted. He really has reason to believe that he is the only obstacle to complete madness out of Washington on the COVID front. And he carries that weight with him in a remarkable way. And, you know, one would like to see him joined by others at the table. Some have stayed away, some have been pushed away. Some, like Deborah Birx, have been overly accommodating to the madness in Washington. And that makes his job even that much more difficult. So I think when we're finished with this, he deserves some sort of crown and a vacation.
Yes, indeed. It's I agree with you. I don't think you overstated anything there about his value and place in history and current day. And he also carries himself with some humility, despite all that. It's like I think he knows how important as you say, is sort of a firewall in this, as we're on the edge of madness. And yet, at least the way he presents, and maybe this is what you mean in part by the politician in him, the humility comes across, which is very reassuring. I think the people who are scared and looking for national leadership and not getting it in the first place we usually look.
And it makes us want to read his book when he finally writes his book. That's the book we're gonna go to find out what really happened in all of this. Yeah, he knows. He knows.
No doubt. I'm going to keep asking for questions until someone tells me we're out of time. Do we have another one? From Rachel. This is for you, Nina. I appreciate what you shared about directly financially supporting communities disproportionately harmed by both AIDS and COVID. Could you share other ways to provide direct support? There's a little bit more to the question, and other ways that advocates can mobilize to directly support sex workers, Black and Latinx communities, and sex workers outside of policy. I know you have rich answers to this question, especially considering the government response has not reached communities that need relief the most. Let's go with that.
Yeah, I mean, so something that I end up talking about pretty often on Them's Health is are all of the different ways to support activism beyond just financial donation, because I mean, within our community, there's already much less money to be had among queer and trans people of color to donate in the first place. And so there's obviously donating, amplifying donations, sharing information about organizations to whatever outlets you have. That could be social media, that could be in conversation with people that you know, in conversation with family. It looks like a lot of the active allyship language that we're seeing talked about in response to Black Lives Matter in terms of how you navigate personal conversations. So if you hear something disparaging about sex workers, for instance, or you're not hearing people talk about the epidemic that is the murder of Black trans women in the United States, that you find ways to bring it up and talk about it. And it's also about finding ways to consistently amplify the work that's being done beyond and in addition to the financial donation piece, and just making it a normal part of your life or your personal budgeting or your conversations with others, or the types of things that you want to bring up, or the lens that you put on news, for instance, and who and what's being talked about. And yeah, I think it's really a combination of the amplification of what's happening that sort of increases the awareness outside of the community that feels just as important. I mean, the money is a big part, but is near similar importance to get more people thinking about it. Because I think in a lot of ways, there's like if you don't know what's happening to Black trans sex workers, for instance, you just don't know. And so once you start hearing about it, you can make the assumption that a lot of people around you also probably don't know, if you're at that mindset coming into it. And if we increase the awareness of it, the numbers are just kind of staggering with how many people are at risk. So yeah, it's the donate and amplify.
Where do you go, Nina, for during your day to just keep up to speed on what's happening in the world? What sources would you recommend or do you look to so that you don't miss the fact that there's been yet another murder of a trans woman of color, and still know like what is Putin up to on this vaccine business? What are some of your two or three just go-to sources that work for you right now?
I mean, for the most part, it's just through. I wish I had the names listed in front of me, but the types of accounts I've curated to follow through Them's Health. It's a lot of activists, a lot of organizations who are talking about all of these things. And I don't know, I think there's also like being a little bit patient with yourself, that you're never going to know everything that's going on at any point in time, because if you did, you would not be able to function just because of all the information you're taking in at a certain time. But mostly through that. Just
that's a great point. David talked about getting older and getting a little more comfortable with certain things. It's been a hard one for me, but I've gotten much more comfortable with saying I didn't know that, or I don't know. It makes it easier to get through the day for me. Eric, what about you? Where do you go for keeping up with the world? Are you watching the Democratic Convention, for example?
I watched Michelle, and my God, what a blessing to have her in our country.
That was fierce, wasn't it?
Truly. The one organization that I also went beyond the ones that I mentioned earlier that I wanted to give a shout out to, that actually I think does a good job of maintaining a list and also honoring those who have been murdered, is the Anti-Violence Project in New York City. Has done some really great work, especially for those who are imprisoned after the case of Layleen Polanco at Rikers, and have done some incredible work bringing her case up to public knowledge. And I believe their website is avp.org.
Thank you so much for sharing that. David, real quick, we're just about out of time. Any recommendations you have for keeping informed in these confusing times we find ourselves in?
Well, I have to confess that I'm deep in the COVID world myself on a new documentary project. So I'm in the scientific literature. I'm watching as these trials are rolled out to see who's enrolling in them. Because if we have a drug that proves safe and effective in only, cisgender, white folks in their 30s, who are not the population that's most at risk, then we really don't know what's going to happen with the medications and the formulations when they roll out. So I'm looking really closely at the science and the trial designs and trying to hold some of those folks to account as they're doing that work.
Holding people to account, that's and holding ourselves to account. That's definitely on my takeaway list from today. Nina, I'm paraphrasing a little bit, but I'm still resonating with me. You said something like maybe masks are today what the AIDS ribbon was yesterday, just sort of a symbol of solidarity. It's a simple, deep thought that I'm going to ponder some more. Eric, all of you guys, I could keep learning from you for a long time, but I think we're near the end of the allotted time, and the producers of this terrific program have their plates full and they're real busy, so I don't want to jam them up. So I'll have to settle for continuing to follow you guys, be inspired by all three of you. David, we'll look forward to that documentary. It's a little mysterious, but we'll sure we'll be learning more about that. Any final words from anybody before we sign off? Starting with you, Eric.
The last thing, I just wanted to give a shout out to Welcome to Chechnya, David. It was truly phenomenal. So congratulations on wonderful. And if anyone hasn't seen it yet, it's essential viewing. So I wanted to make sure that I got that out there.
Thank you. HBO, everybody.
HBO. Nina, any final thoughts, and then we'll wrap.
No, just thank you all very much. I'm glad that we were able to keep the communities most affected kind of core to this conversation today.
That's so true. And thank everyone for tuning in, submitting your questions. It really helped the content of the program. And everybody, please stay safe and engaged, and vote. Don't forget, not voting equals death. Thank you all.
Thank you.
Wash your hands.
Thanks, everyone.
Amen.